On the Medical Watch, hope for patients with sudden hair loss. After two teens lost their hair, they found their voices. Now they and their families want to grow awareness about a lesser-known treatment for alopecia, the condition that once robbed them of their self-confidence.
I had started getting more and more bald spots for about 6 months, and I never thought that I would completely lose everything.
But at age 15, he did. Luke Campbell hid his hair loss under a hat.
I lost a lot of self-esteem, social anxiety definitely, and it's tough leaving the house looking like that.
It was frustrating and it was mentally draining, going to doctor after doctor after doctor.
Matthew Riccardi was just 11 years old when he was diagnosed with the same condition, alopecia areata, an autoimmune disorder that targets the hair follicles. Like Luke, the then 6th grader was given topical treatments, but nothing helped.
We would read on the internet, one person said, rub garlic on your head. I mean, take gluten out of your diet, stop eating pasta, whatever it may, like crazy things. And we kind of, you're desperate. You're seeing your child suffer. So I feel like you want to try whatever you can.
Thankfully, the two families found support and a promising treatment thanks to a savvy dermatologist.
I was aware of what at the time was very preliminary science from a mouse model of alopecia areata, showing that this, at that time, brand new class of medicines called Janus kinase or JAK inhibitors reversed alopecia areata or grew hair in this mouse.
It did the same in humans, even though the drugs were more commonly used to treat rheumatoid arthritis.
It changed the world forever for people living with this condition and their families.
In patients with the hair loss condition, their own body mistakenly attacks the hair follicles. JAK inhibitors work to tamp down the overactive signals between the immune system and the follicles. Eventually, normal hair growth resumes.
I was nervous about taking a drug because at the time, there were no JAK inhibitors that were approved by the FDA. They were still in experimental use. And I'm like, am I going to put an off-label drug into my child?
While both boys regrew their hair, they may have to take the drugs for the rest of their lives to keep it.
After 4 to 6 weeks, we started to see peach fuzz again and my hair started to grow.
I started having hair right here on my eyebrows, and then eventually my whole eyebrows came in, and then I think it was another 6 months before I started having hair on my head.
It's really beautiful to be able to give normalcy back to people and their families, and in that process, restoring wellness and mental health.
Still, cost is a factor. JAK inhibitors range between $30,000 and $70,000 annually.
The doctor has to talk to the doctors at the insurance company, right? And you have to get through the first hurdle of them denying it, and you have to go through the process. But that's what Dr. King did. He took this on, and he sent them articles and talked directly to the doctors from the insurance companies. And once that was done, it was covered.
It's a fight Luke and Matthew hope others can avoid. The teens took their success stories to the nation's capital to lobby for faster access to the effective treatment.
They really encouraged me to talk to Brad Schneider, and they encouraged me to talk to other people who have this disease and who don't have access to these other medications.
I'm like back to my normal self when I was before this, but I still remember what it was, and I still don't want people to suffer. So I feel like it's very important that I advocate for this.
And remarkable results, as you can see. The annual National Alopecia Areata Conference takes place this week, right here in Chicago. And Dr. King will be on hand to discuss JAK inhibitors. We have a link on our website. Back to you.
Great story. Thank you, Dina.